Tuberculosis, TB, is a contagious bacterial infection that primarily affects the lungs but can also affect other parts of the body. TB is caused by the bacterium Mycobacterium tuberculosis and spreads through the air when someone with active TB coughs, sneezes, or talks. Symptoms: the symptoms of TB can include coughing, chest pain, fever, night sweats, fatigue, and weight loss. In some cases, TB can also cause blood in the sputum or coughing up a phlegm. Diagnosis: TB can be diagnosed through a variety of tests, including a chest X-ray, sputum culture, and a tuberculin skin test. If TB is suspected, it is important to see a healthcare provider right away for testing and treatment. Treatment: TB is treatable with antibiotics, but it can be a long and complicated process. Treatment involves taking a combination of antibiotics for at least 6 months to a year, and it is important to complete the entire treatment to prevent the development of antibiotic-resistant TB. Prevention: the best way to prevent TB is to avoid exposure to the bacteria by practicing good hygiene, such as washing hands frequently, covering the mouth when coughing or sneezing. High-risk populations: certain populations, such as those living in poverty or with weakened immune systems, are at higher risk for TB. Additionally, TB is more common in countries with limited resources and poor healthcare systems. Global impact: TB is one of the top 10 causes of death worldwide, and it primarily affects developing countries. In 2019, there were an estimated 10 million cases of TB and 1.4 million deaths from the disease. Stigma: TB has a historical association with poverty and marginalized communities, which has led to stigma and discrimination. It is important to raise awareness and fight against this stigma to ensure that people with TB can access the care they need without fear of discrimination. Research: there is ongoing research into new treatments and vaccines for TB, as well as efforts to improve diagnostic tools and reduce the burden of the disease worldwide. Conclusion: TB is a serious global health issue that affects millions of people each year. It is important to raise awareness about the disease, increase access to testing and treatment, and work to reduce the stigma associated with TB.